Hey everyone, thanks for joining us again for another episode of Kidney Cancer Conversations. I'm Scott Nicholson, and today I'm very excited because we have Monica Bryant. Monica Fawzy Bryant. She's a cancer rights attorney and speaker and author who's dedicated to improving access to quality information on healthcare related issues. She's the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. So, thank you so much, Monica, for joining us today.
I'm absolutely delighted to be here. Thanks for the invite.
So, Monica will be having a leading conversation on what's legal about cancer, and she'll be sharing her screen in just a moment. But in the meantime, if you have any questions that come up through the presentation, please type those into the chat or save them for the end, and we'll make sure to get your questions answered. All right. And without any further ado, please, Monica, take it away.
Thanks so much, Scott. And thanks to all of you for joining today to talk a little bit about what's legal about cancer. As Scott mentioned, I am co-founder and chief operating officer for an organization named Triage Cancer. We are a national nonprofit that provides free education on the legal and practical issues that may impact individuals who are diagnosed as well as their caregivers. Now, many times in the real world, when someone says, "What do you do?" and I say, "I'm a cancer rights attorney," I get a blank stare back typically, or the question, "What's legal about cancer?" And the short answer is almost everything. From what drugs we are able to take to treat conditions, to what our insurance companies have to cover, to our rights at work, to decisions around our medical care and finances. All of those things and so much more are rooted in the law. And what we typically find is that people need to have an understanding of all of these different areas of the law to effectively navigate a diagnosis, both to access medical care, but also to make sure that they stay financially healthy as well. So we're going to talk about a few of these things today, and I'm going to tell you a little bit about the organization, because even though we're going to spend, 45 minutes together, you may find that you have questions that come up tomorrow, next month, next week, next year, and I certainly want you to know that we can be a resource for you, as well as the Judy Nicholson Foundation. So I mentioned that Triage Cancer provides education on the legal and practical issues, and we do that in a number of different ways. So we host educational events. These range from 90-minute webinars that we do once a month to full day-long conferences. All of our events are free to attend, and we do provide continuing education for nurses, social workers, and patient advocates. All you have to do to attend is just sign up on our website. And then we also provide education in other ways. So we have written materials that range from 1 to 4 page quick guides and worksheets to longer publications that we call our cancer rights guides. But we know that not everybody learns by reading, and so we have animated videos, we have recorded webinars, we have charts of state laws, because where you live is going to impact perhaps what you have access to. So we really try to meet people where they are with respect to how they learn, the capacity for new information, given where they are in that moment. But we also know that no matter how many resources we create or events that we host, sometimes you just need an answer to your specific question. So to address that need, we have established a legal and financial navigation program. This is an opportunity for perhaps someone who's been diagnosed, or a caregiver, or even healthcare professionals and advocates to fill out a form on the Triage Cancer website. Let us know a little bit about what they have a question about, provide us with some basic demographic information, and then they have the opportunity to schedule a phone call with one of us. On that phone call, we explain the various options someone might have. Perhaps it's what programs they have access to, or how they can make a choice between different insurance policies. We try really hard to break through some of the clutter that exists out there, and to provide accurate information, and then give people the next steps to take. So while we don't provide legal representation or legal advice, what we know to be true is a vast majority of the time, people don't need that. What people need is just clear, reliable information. And that's really what we're trying to do here at Triage Cancer. So what are the types of issues that people come to us with? Well, it definitely runs the gamut. This shows you some of the most common issues that callers contact us about. And the three most common are health insurance, disability insurance, and employment issues. So we'll definitely talk a little bit about that today. So this is a pretty typical story that we hear. So Lori is a manager at a small company. She's been diagnosed with cancer. Her oncologist doesn't think she should return to work. She has short-term disability and health insurance through work, but her employer pays all those premiums. She doesn't really understand how unemployment and short-term disability and this federal SSDI thing she's heard about all work together. She doesn't know if she could stay at work. And if she doesn't stay at work, how does she keep her health insurance? So Lori reaches out to us, very anxious about her future, understandably. So we often describe what we do using an analogy of puzzle pieces. And so if you've ever put together, one of those 1,000-piece jigsaw puzzles, you know that it can be increasingly more difficult if you never look at what the picture is on the box. And that's what it can often feel like to people who are navigating this experience, where they don't really understand or know what the full picture looks like, and they're getting only bits and pieces of information at a time. So what we try to do at Triage Cancer is explain what those individual puzzle pieces are for people and how they best fit together in their situation. So what are the puzzle pieces? Well, certainly they're going to be the federal laws and programs someone might have access to. Perhaps it's the state law and programs. It's certainly going to be dependent on employer policies and what type of insurance someone has access to. And then, of course, what they might qualify for with respect to financial assistance or other types of financial conversations. But the thing about all of this is the details matter. And so oftentimes when people ask me questions, my initial response is a whole bunch of questions back to them. Because typically, in order to answer a question, the details are going to matter. And the law, for better or worse, is full of details. Now, I mentioned that part of what Triage Cancer is about is making sure people can access the care that they need, but also maintain their financial health. And you may have heard this term financial toxicity in the past. It has certainly become more common over the last several years, but it describes the financial burden or impact that a cancer diagnosis can have on somebody. And even though this was coined in 2013, we're still talking about it on a regular basis a decade later. Part of the reason for that is there are multiple contributing factors to financial toxicity. And if we, as a system, aren't helping people address all, or at least most of these contributing factors, we're never going to be able to solve the problem of financial toxicity. So sometimes people come to us and ask for financial assistance, and we say, well, as an organization, that's not something that we do. We have partnerships with lots of other organizations we could potentially point you to, but before we do that, let's dig down and get to the root or the cause of the financial hardship, because maybe it's about having inadequate health insurance. We certainly know that that is the number one most significant contributing factor to financial toxicity. And believe it or not, it is generally not about someone who's uninsured. It is more often about someone who doesn't have the right health insurance policy for them, or they don't know how to effectively navigate those policies. Certainly, the employment changes that can occur after a cancer diagnosis could impact somebody's finances. And then all of the things that normally might impact finances in life continue to happen. So relationship changes, moving, all those things are going to impact our finances, compounding the challenges. So given that health insurance is the number one most significant contributing factor, that should actually be a relatively simple thing to solve for. But it isn't, because there is so much confusion, understandably, because our healthcare system is very complicated, about health insurance. In fact, we often say there should be a class in high school on health insurance and finances, because we all eventually have to navigate these things, but rarely are we ever formally taught how to. And I can say that with some confidence because we have data that shows 96% of Americans don't even know what the 4 most basic terms used actually mean. So if you don't understand the words that are being used in a policy, how can we possibly expect someone to be able to effectively navigate those policies or figure out which policy is best for them to pick? So to just give an example and make sure that we are all on the same page today, I'm going to talk about some terms related to the costs. The first is your monthly premium, and this is how much you have to pay every single month just to have health insurance. You're going to pay that whether you go to the doctor or not. It's very similar to having car insurance all year, but never getting into an accident and filing a claim. But when you do access healthcare and go and see the doctor, you're going to have some additional costs. The first is your annual deductible. This is a fixed dollar amount that you have to pay every single year. And you have to pay that amount before your health insurance kicks in. Now, what that dollar amount is going to depend on the policy. Some policies have a $500 deductible. Some have a $5,000 deductible. So that really just depends. But keep in mind, regardless of the actual dollar figure, you have to pay that out of pocket before your insurance kicks in. Once you've met your deductible, then you're responsible for the co-insurance, also known as cost share. So this is a percentage, and it's the difference between what the insurance company is responsible for paying and what you're responsible for paying. So once you've met your deductible, let's say you have an 80-20 co-insurance, you're going to be responsible for 20% of the bill, and your health insurance company picks up the other 80%. In addition to co-insurance, many policies also have co-payments. This is, again, a fixed dollar amount that is going to depend on the policy, but it could also depend on the service. So for example, it's really common to have a co-payment of $20 just to go see the doctor. And maybe you have a co-payment of $30 if you go see a specialist, and $250 if you go to the ER. Many policies, again, have both co-payments and co-insurances. But one of the most important things for all of us to understand about our health insurance policies is if there is an out-of-pocket maximum and how much that out-of-pocket maximum is. The out-of-pocket maximum is, again, a fixed dollar amount that represents the most you are going to pay out of pocket to get medical care. So the way that you get to your out-of-pocket maximum is a math problem. And different policies have different equations, but generally it's going to look something like this, where we're going to add up everything we pay towards our deductible, everything we pay towards our co-payments, and everything we pay towards our co-insurance. So it's everything we're paying out of pocket except those monthly premiums. Why is it so important to understand this? Well, it allows us to plan for a worst case scenario. And so let me give you a quick example. Meet Dan. Dan has a policy that has a $2,000 deductible. It's an 80-20 co-insurance, and he has an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor at all this year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, remember, the first thing we always have to pay is that annual deductible, $2,000. We subtract that from the overall bill, leaving $100,000 left. He's met his deductible, so now the insurance company is going to pay 80%, and he's responsible for 20%. 20% of the $100,000 is $20,000. But does Dan have to pay that $20,000? The answer is actually no, because of that out-of-pocket maximum. So the way we figure out how much he has to pay of that remaining bill is we figure out the out-of-pocket maximum, we subtract what he's paid so far, which is the $2,000 deductible, leaving $6,000. Now, I realize this is a lot of math, and I became a lawyer, so I didn't have to do math, but here we are. If you would like to hear any of that again, the terms that I just went over, or this example, that's what's included in our animated video on health insurance basics. This seems somewhat straightforward when we give you the example of Dan, but what we know to be true is that in real life, it rarely is this simple. You're getting lots of bills from different places, and it can be hard to kind of keep track of everything. We have a number of resources designed to help you navigate your different health insurance options, figure out how to choose between one or more policies, as well as tools like a medical bill tracker that helps you track how close you are to meeting your deductible and or your out-of-pocket maximum. Once you've met your out-of-pocket maximum, then you are paying nothing for the rest of the year except your monthly premiums. So that was just sort of a quick snapshot on the type of information around health insurance that we try to provide people. And if you go to our health insurance resource hub on our website, you can see all of the different resources that we have available for free to help people navigate their policies, whether they have individual insurance or insurance through a job, Medicare or Medicaid. We even have information on military plans as well. Now, the second most significant factor the second most significant contributing factor to financial toxicity is around employment. And when we talk about employment, the first thing we often have to get people past is the assumptions they might be up against. We often find that employees are battling assumptions around the idea that now that they've been diagnosed, they can't work and there's nothing that could be helpful. They certainly could be battling their employer's assumptions that, hey, now that my employee's been diagnosed, they can't work and there's nothing that can help. But we often find that they're also battling their healthcare professionals' assumptions. There's lots of times where we hear healthcare professionals say to patients, well, you know what, just go out on disability. And while that might be necessary for some people, that it's not always as easy as the providers can make that sound, because certainly there are lots of reasons why someone may want to work or need to work. So assuming that someone is trying to figure out what their rights are in the employment context, there's a couple of different places that we might go to look. So there are fair employment laws that provide protections against discrimination, plus some other tools. We have those fair employment laws at the federal level. We also have them at the state level. And that's really important to keep in mind because sometimes the eligibility requirements for the federal law are harder to meet. So for example, perhaps they're going to require a larger employer be involved. And if someone works for a small business, we would then want them to go look to see what their state law said. If someone needs to take time off work, whether that's for a short period of time or a more extended period of time, they may have protections under leave laws, which again, we have at both the federal level and the state level. But then if someone is working under an employment contract or is a member of a union, that contract or collective bargaining agreement might provide different or additional rights and benefits that we would want to look at. But believe it or not, before we would even look into what laws might apply, we would want to remind someone that the law is just the bare minimum of what employers have to provide. And many employers are much more generous than that bare minimum. So the first step is often about going back to the specific employer and looking to see if there are policies in place or benefits that are being offered that an employee could tap into that may not have anything to do with a law. Most people are surprised to learn that if they have access to sick time or any other sort of paid time off, that is almost always a benefit of the employer, not necessarily a requirement by law. Certainly, different states, counties, and municipalities have different laws around paid leave. But in a vast majority of the places in this country, if you have sick time or paid vacation, that's just because your employer has decided to provide that for you. So going back and looking at what the employer provides is almost always going to be step one. So where would you go to look for that? Well, maybe there's some sort of employee handbook or policies and procedures document. Some larger employers now use online portals to house that information. Some are still, more traditional in the 3-ring binder type thing. But even if someone works for an employer that doesn't have one of these formalized handbooks, they could certainly be asking whomever at the job deals with employee benefits, who do you turn your timesheet into? Who's the person that you go to ask for the day off? That might be the person that you could at least start with to gather some of this information. Now, I mentioned that the fair employment laws provide protection against discrimination. They also provide a tool called a reasonable accommodation. Reasonable accommodations are any change in the work environment or in the way that things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Big old long legal definition. It's so much easier to talk about reasonable accommodations with examples. And accommodations can really fit into 3 main categories. The first category is about space. So maybe it's about moving offices. If your office is next to the, garbage disposal for the break room and all you're doing is smelling bad smells all day and it's making you nauseous, can you move to another office? Or maybe if you're dealing with severe fatigue and your parking spot is 2 miles away from your workplace, can you somehow move them closer? Maybe it's about accessible work equipment or special furniture you might need. Maybe it's about working from a different location. So if someone is in a situation where there's like multiple offices and they're commuting 45 minutes each way, but there's a closer office, maybe they can move to the closer office so that they're conserving energy for the workday. Certainly, it could be about telecommuting, which could mean working from home, of course, or maybe from another location. So sometimes people will get an accommodation to work from an infusion suite, for example. Of course, this isn't going to work for everybody, but these are just some suggestions. So first category is space. Second category is schedule. Maybe it's about changing the hours you're working or additional breaks or a flexible schedule. So that could be a situation where maybe you work 4 10-hour days instead of 5 8-hour days, or you don't have a set time you're working as long as you're getting your projects done. It could also potentially be about extended leave. And then the last category is everything else. So would technology be helpful for someone who is dealing with pain or neuropathy in their fingers and they have to type all day? Could speak to type software be useful? Could it be a change in policy? So, for example, some employers have a very strict dress code policy, and maybe because of somebody's treatment, they are dealing with temperature sensitivity and they need to be out of that dress code. That could be an accommodation. Sometimes it's about shifting responsibilities. So a school teacher who's asked not only to teach children, but also stand in the drop-off line and cover recess, but is dealing with severe fatigue. Well, maybe instead of drop-off and recess duty, those can be shifted to other employees, other teachers, so that teacher can just rest during those parts of the day. And then sometimes it could be about a change in job entirely. Now, when I talk about reasonable accommodations, I often say that they are one of the most valuable tools for someone who is trying to work through treatment, return to work after treatment, or even to take time off. But they are unfortunately wildly underutilized. And that's for a number of reasons. Sometimes people just don't know about them. Sometimes I hear from people that they're kind of concerned about asking, or they don't want to ask for something else. But I think it's important to shift the narrative around asking for these accommodations, because employers that are bound by the ADA are required to provide reasonable accommodations. Now, in order to be bound by the ADA, they do have to be a private employer with 15 or more employees, or a state or local government. So if they have 15 or more employees, they are required to provide eligible individuals with accommodations, unless they can show that it's an undue hardship or a direct threat, which is a very high bar for the employer to have to meet. But that doesn't necessarily mean someone's just going to get whatever they ask for. So the thing that they're asking for does have to be reasonable. So remember, I was talking about telecommuting. Well, for some jobs that require a computer and Wi-Fi to do, telecommuting might be a very reasonable job or reasonable accommodation. For other jobs, like a school bus driver, for example, telecommuting may not be a reasonable accommodation. One other thing about accommodations I just want to mention is only individuals who have the disability are entitled to reasonable accommodations under the law. Therefore, caregivers, while they are protected from discrimination, are not legally entitled to these kinds of adjustments. That being said, many times employers want to keep valued employees. And even if that employee is a caregiver, if there is an accommodation-like request that could allow that person to be a caregiver while still being a valued employee, they might be open to that. So it sort of falls into that. It may not hurt to ask for the accommodation as a caregiver, but just keep in mind you're not legally entitled to one. Now, I mentioned that accommodations are one of the most valuable tools, and to that end, we have a number of resources that can help you navigate asking for the accommodations, suggestions around accommodations, and keep in mind that many times it is not necessarily the cancer itself that is the reason for the accommodation. It is many times the side effects of treatment. So that's why you see side effects in the title of a lot of these different resources. Now, for someone who may need to take time off for an extended period of time, we might look to see if they are eligible for the Family and Medical Leave Act, or the FMLA. This is a federal law that allows individuals to take time off to care for their own serious medical condition, or to act as a caregiver for a seriously ill child, parent, or spouse. That is a very narrow definition of family, but that is the definition. So under the FMLA, those are the only individuals someone could take time off to care for. So that doesn't include siblings or aunts or parents-in-law or grandparents or grandchildren, for example. It is only child, parent, or spouse. So what does the FMLA give someone? They're entitled to up to 12 weeks of leave per year. Now, that leave is unpaid. We'll talk about how to deal with that in just a minute. But the value behind the FMLA is that it is job protected leave, which means someone cannot be let go or demoted for taking this leave. That is very different than sick leave, vacation time, even if someone's using perhaps a short-term disability policy. None of those things protect somebody's job. What those things do is provide money, but it's the FMLA that provides the job protection. And so we often say it puts someone in an FMLA bubble. They're protected in this bubble. Also, if someone is taking FMLA leave and they have an employer that pays for a portion or all of their health insurance, the employer has to continue paying that portion while someone's out on FMLA leave. Now, the FMLA can be very useful because it's flexible. So you could certainly take your 12 weeks in a solid chunk, You could take it in different segments throughout the year. You could potentially take it for different reasons. So maybe you take 3 weeks off at the beginning of the year to act as a caregiver for your child, and then you get sick and you take another, 9 weeks off as for your own serious medical condition. It can also be used intermittently. And this is where it's kind of there for you when you need it. So maybe it's a day you're not feeling well, or a day you have to take off for an infusion or doctor's visits. You can use it in those small little bits of time. So it is actually quite flexible. Now, of course, I've given you the 50,000-foot view of employment rights, but just like with health insurance, we have a resource hub on our website on work and employment that has all of these different resources, in addition to other aspects of work, like looking for work, taking time off, and retiring. Now, I mentioned that the FMLA is unpaid. And so what does somebody do to replace lost income if they're not able to work? And this brings up the conversation around disability insurance. Disability insurance is a type of insurance that replaces a percentage of what you were making when you were working. There's a number of sources of disability insurance that someone may have access to. So there's private disability insurance policies that maybe you've gone straight to a company and just purchased. Many times people have access to disability insurance policies as an employer benefit. So the employer says, we offer you short-term disability. These private policies can be both short-term and long-term. You see the word generally a lot on these slides because with these policies, it really is going to depend on the specifics of the policy we're talking about. Generally, short-term is going to be, up to 6 months. Long-term is usually more than 12 months, but again, it's really going to depend on the details of that specific policy. Now, there are a handful of states, and I literally mean a handful of states that provide state disability insurance benefits. These are generally, these are short-term policies that are usually paid for by paying in through payroll taxes. So after you've worked X amount of time in these states, you have access to state disability. And then there are 2 federal programs. Both of these programs are run through the Social Security Administration, and both are long-term disability insurance programs. The first is Social Security Disability Insurance, or SSDI, and the second is Supplemental Security Income. Now, they are very different programs, but the one thing that one of the things that they have in common is their definition of disability. And this is the highest standard of disability that we have in this area. And it's that you cannot do your job, you cannot adjust to a new job, and your disability has or is expected to last for a year or longer or result in death. So very high standard. It's not just about, I can't do my job anymore. It has to be, I cannot work. Now, in order to be eligible for Social Security disability insurance, you have to have worked and paid into the system. And sometimes people will say to me, well, I don't know. I don't know if I have enough work history. So then our suggestion is to sign up for a My Social Security account. So the Social Security Administration used to send out these paper statements every single year that would tell us, if you retired tomorrow, this is how much you would get as a monthly benefit. Some people still get those statements in the mail. Many people do not. I cannot figure out, there doesn't seem to be any rhyme or reason as to who gets them and who doesn't. But the good news is we can all sign up for these My Social Security accounts. And when you sign up for that, you're able to see all of the information you would see on those paper statements, including if you have enough work credits to be eligible for benefits. So if you log in and you see you have the 40 work credits, this green bar, you know you would be eligible for both retirement benefits and disability benefits. You would also see an estimated amount of how much you would get each year. Now, Social Security disability insurance is based on having worked and paid into the system. Supplemental security income is based on having a low income and a low asset level. And assets are things like savings accounts or retirement policy or retirement accounts or life insurance policies. So they're both of these programs are run by the Social Security Administration, but again, very different eligibility requirements. And I want to make sure I leave enough time for questions, so I'm going to wrap up pretty quickly. But one thing I do just want to mention about disability insurance specifically is that about 65% of all applications are denied on the first round. So if somebody applies and gets denied, the first message I give to them is, this is normal. This happens to a lot of people. And the second message is, there is opportunity to appeal this denial. And on the first level of appeal, it is critical to go back and work with the healthcare team, not just to document the medical condition, because this happens a lot. People will tell me the dosages of things they're taking and the frequencies and use all these medical terms. What the Social Security Administration cares about is how is all of that impacting your ability to work. And so it's best to do it in the initial application, but if someone has to appeal, making sure they focused in on the impact on work is usually important in terms of their success. Now, of course, like with everything else, tons of resources on disability insurance found on our Disability Insurance Resource Hub. I'm gonna absolutely open it up for questions, but as a reminder, if you want to learn more about any of these topics in a live way to be able to ask your questions in real time, we have a couple opportunities. We have our second Triage Cancer Conference coming up this fall. Registration is still open. It is virtual, so you can join us from the comfort of your couch. All you have to do is register on our website. And then, of course, if you have specific questions that maybe you don't feel comfortable asking in a group environment or something that comes up later, you can certainly reach out to us via the Legal and Financial Navigation Program. And that's just at triagecancer.org/get-help. So I'm going to throw this up as just some other ways that you could certainly stay connected with Triage Cancer, and I am happy to take questions.
Thank you so much, Monica. We did have some questions come in through the chat. And the first one comes from Sherry. Oh, I'm getting a bit of feedback here. Let's see. The first question comes from Sherry. Once medical disability has been approved, what are you supposed to do while waiting for Medicare benefits 24 months later? Why aren't disability and Medicare benefits coordinated to begin together?
So I'll answer your second question first, because Congress decided that they weren't going to be at the same time. There are some advocacy opportunities right now to both reduce the waiting period before SSDI benefits start and to allow people to become Medicare eligible sooner. So certainly reach out to your elected officials in Congress and let them know if you support or oppose either one of those opportunities. We have more information on our advocacy page about those specifics. But in terms of what are you supposed to do, again, it's going to depend. So some people, if they have the option, keep COBRA. So COBRA is the federal law that allows you to keep your employer-sponsored insurance even when you no longer have your job. And if someone has been approved for SSDI or SSI, they get an 11-month extension. So they get to keep COBRA for up to 29 months, which theoretically bridges the gap until you're Medicare eligible. One of the challenges, of course, is you're not working and COBRA premiums can be very expensive. So then what? I would need more information. Some people may be Medicaid eligible at that point, or potentially they could purchase a plan in their state health insurance marketplace, and they'd likely be eligible for financial assistance. Or potentially some people have access to another group plan. So I would definitely want to talk to you more and learn more about your situation to be able to sort of say, you know, this might be an option or that might be an option, because as I shared, so much depends on the details.
Thank you, Ms. Bryant. And if anyone does have any more questions, you can feel free to type those into the chat, or you can unmute yourself now. Sherry had another question. Do you have legal right to request Medicare earlier if you're stage 4?
No.
Tracy asks, can you also touch on LTD overpayments once approved for SSDI? Thank you so much. Offsets.
Sure. So LTD is long-term disability, and that's one of those private policies I was talking about. And what often happens once someone starts collecting from a private long-term disability company is that those policies usually kick in pretty quickly. They don't have the waiting periods as long as SSDI. So a lot of times those long-term disability policies start paying someone. And then after a certain amount, they require that beneficiaries go and apply for SSDI. If they are approved for SSDI, then you can actually collect both. And what happens is the long-term disability policy gets prorated by the amount that SSDI is paying you. So let's say your long-term disability policy is 90% of what you are making, and Medicare or SSDI is going to pay you 50%. What happens is SSDI pays you the 50%, the private pays the 40% to make you whole at 90%. With SSDI, there are back payments and retroactive payments because it takes them a long time to approve benefits, and it may have taken you a while to apply for SSDI based on like when your disability began and when you applied. So if the Social Security Administration says, yes, you're entitled to retroactive benefits or back payments, during that whole period of time, your long-term disability has been paying you. So if you get a lump sum from the Social Security Administration, you've essentially double dipped for those months where you've been paid the 90% by your LTD policy and the 50% by Social Security. So you can't make more than 100% of what you were earning from disability insurance. So what the long-term disability policy says is, we want our money back. So give us all of your back and retroactive pay. What sometimes happens though, is that's not clear to people, and they get their first check from Social Security Administration and it's a bigger lump sum. And most of the time people are elated because they feel like they can finally pay off bills or deal with debt or just have some breathing room, and they spend the money. And then the private policy comes a knock-in and says, we'd like our money. And if you can't give it to them, they actually have the right to reduce their future payments, and put you on a sort of payment plan, so to speak. So I don't know, Tracy, where you are in that process, but if you haven't gotten your big lump sum SSDI payment yet, what I would say is make sure you hold on to that first check until you figure out what the long-term disability policy is going to ask for, and so that you have it ready. If you're in the latter situation where perhaps you've spent it and don't have it anymore and are trying to figure out options, you could certainly reach out to us, but know that the long-term disability policy is allowed to prorate their amounts moving forward until you essentially pay them back.
Yeah. Tracy says thank you. We all say thank you as well. Monica, this has been great. If anyone missed any part of this recording, this conversation, we'll be posting the recording on our website next week. So please stay tuned for that. And tonight, At 7:30, we're having our caregiver connection talk. So if there's anybody that has caregivers, or if you're a caregiver and you're looking for a place to chat with other people that are experiencing similar situations as you can register for that on our website tonight. It starts at 7:30. Um, okay, I think that's all our questions for today, Monica. But thank you so much for your time, and I'll talk with you again soon. Have a great day,
Thank you
everybody.
again for having me. I hope you have a great day.
Thank you.